Hi you guys, this is Dr. Tahir from Family Pediatrics in Kenosha, Wisconsin. Thank you so much for joining me today. Today I'll be talking to you guys about a very important topic, and that involves constipation in little babies. As many of you might know already, constipation can cause some very severe pain with babies. And I'll be talking to you guys about how to use a suppository today, or rather how to use the right amount of suppository for your baby. So I'll be showing you the suppository that I got from the pharmacy, and this is from Walgreens, and this is a pediatric glycerin suppository. This one says children glycerin suppositories for ages 2 through 5. So if your child is 2 through 5, you would use a whole one of these, but if your child is younger, you'll want to use a smaller amount, and I'll show you how to do that. Alright, so let me show you what I have. Do you notice this says children glycerin suppositories laxative, and it says for ages 2 through 5. So if your child is 2 through 5, you can use a whole suppository. But if your child is younger than that, you're going to have to cut this to a smaller size. So let me show you what the whole suppository looks like. So right here is the suppository for 2 through 5, and you notice one end of it is pointy and the other end is flat. You want to be using the pointy end and inserting this into the anus and into the rectum so that you can help your child with constipation. But if your child is younger than 2 to 5 years old, let me show you how to cut this to different sizes. So first I'm going to place this over here and label this whole for ages 2 through 5, you see. And now what I'll do is I'm going to get another suppository just so I can place this over here and leave the first one where it's at. And what I'll be doing with this one is I'll be cutting this in half. So we'll just use 1/2 of this, 1/2 of it for children that are 12 months to 23 months. Cutting it is very easy. You can use a butter knife or a single-edged razor blade or a different knife. So I have a knife here that I'll be using, and I'll be cutting this. The knife goes through there very easily. You'll be discarding this back part. You notice the back part is flat on both sides, so you're not going to be able to use this. We're going to just discard that. And we're going to keep the end with the pointy side, you see? So we're going to use just half of this. We're going to put the pointy end in first, of course. Now let's say your child is younger than that even. And how much should you use if your child is younger than that? Well, in that case, what we'll do is we'll cut this in half again and use that, which will end up being a fourth, but this will use for children that are 6 months old to 11 months old. So to cut that in half, you're going to simply use the suppository. Take the suppository. You're going to cut it in half first, like we did already. Discard the back end of it. Now we're going to cut this lengthwise in half also. You see? Just like that. Now if you take a look at this piece, this is a half of a half, which is a fourth, you see? That's what we'll use for a younger child. I'll put that back over here. Now let's say your child is even younger than that. And for kids from birth to 5-month-old, I'd like you to cut that even in half, okay? So if you guys are good at math, you know that that's an eighth now, but it doesn't really matter. As long as you remember to cut it in a small little sliver, that's what we're doing. So I'm going to cut this one in half, and we're going to use just this one part of it, you see? Just that part. So that will actually go in the rectum pretty easily for the little babies. And that's what you'll want to use for the birth to 5-month-old. Be careful when you're cutting these because they are pretty slippery And so there's a risk of you injuring yourself, so please be careful when you cut this. Well, you guys, I also want to let you know that a suppository really is for urgent use. It helps with constipation, causing pain right away, but it's not really for ongoing longer term use, okay? Talk to your doctor about constipation if your child's having ongoing problems. I hope you guys learned how to use a suppository for younger kids and feel comfortable doing that if you need to treat your child. If you have any questions or concerns, make sure you call your doctor about that. I wish you guys all the best and have a great day. Bye-bye.